We have found everyone. Hello there.
Mr. President, we're live.
Excellent. Thank you. All right. Good afternoon, everyone. It is yet another week and in the midst of vaccine distribution. This has been a bit more of a chaotic week because of the sort of horrific tragedy happening down south, particularly in Texas. And I know that has certainly impacted not only distribution, but just the networks overall. The good news, I think there's still very good news that, and I think Mr. Powell will speak more about this, but that we've continued to see a decline in COVID in the state and, tracking nationally, which is a very, very, very positive thing. And today the acting secretary has a presentation. So we're going to have a little bit less time for questions today to make sure that we stay within our time frame. But I don't want to take up any more time, so we can jump right into it. Mr. Powell, if you could go ahead and kick us off for the week's update.
Glad to. And if Jake, you could put the PowerPoint up there, I'll be as quick as I can. There it is. So as President Ferguson mentioned, the number of new positive cases down over 2/3 since mid-December when we first had vaccines available. The positivity rate's down by almost half. Number of testing being done daily is down by about 1/3 as well. Hopefully a reflection on people not feeling sick. Next slide. Daily vaccine numbers. I know the departments may look slightly different than this, but there seem to have been some issues with updating things that maybe had been entered in the past. But what we show is a decline this week in the number of vaccine doses, first and second doses given out. Some of that may be weather related. I think it's actually lower than the previous 2 or 3 weeks. So might want to keep an eye on that. Next slide. This is of all the doses we've been given, how many have been used. Orange is the used, blue is unused. You see a little blip there that's strange. I appreciate the department helping clarify that for me. I think that issue has been resolved. Next slide. MDH determines whether a dose is a first or second dose before it's used. This is of first doses that we've been given, how many have been used, and it seems like most of them have been. Next slide. Same thing for second doses. It looks like we have more of those available as presumably people are scheduled to come in and get their second vaccination dose. Next slide. We just keep continuing to monitor the ratio between first and second doses given out on a regular basis. And I think for about the first time this week, we gave out more second doses than we did first doses. So I think for about every 4 firsts, there were about 5 second doses given out. We'll continue to watch that. Next. We introduced this about 2 weeks ago because we expect that if the vaccine strategy is working, we'll see a decrease in deaths because the vaccine is going to people who are most at risk for being sick or dying or hospitalized from COVID. I think it's still probably too early to see that if it is happening, but we're going to continue to monitor this. This shows the number of positive cases, that's the blue line, and the number of COVID deaths since mid-November. Next. This is where Maryland ranks compared to the other 50 states and I believe DC in terms of percentage of the population that's received a first dose and a second dose. So the higher you are, the more second doses, more population has gotten a second dose. And the further to the right you are, the more of your population has gotten a first dose. You can see Maryland sort of in the pack, I guess, at around a little over 12% of our population having received first dose, somewhere around 5.5% receiving a second dose. You see a place like Connecticut that's had a lot more doses distributed. They actually happen to have received a lot more vaccine than we have. I'm not sure why, but just want to point that out, that that's not necessarily because they do an amazing job at getting this stuff out. They happen to have gotten about 20% more vaccine, I believe, per person than Maryland has at this point. Next slide. All right, so this is maybe a little bit new, but instead of putting a bunch of dots, 50 dots on a chart, I wanted to show the amount that the CDC reports that Maryland has been given and how much of that has been used. And what we did is that top line is of the 10 states that have used the most of what they've been given, that's sort of where they are. So I think they've got about 15% of their allocation unused. The blue line at the bottom is of the states that have used the least of theirs. The red line is the average of all the states, and the gray line is Maryland. So you can see we are closer to the group of states that have used the least of the vaccine they have been given, according to CDC data. Next slide, please. A little bit different. This is of first doses. It's the population based on the amount of first doses that have been given, and we compare the states. So the 10 states that have given the most are the black line at the top. The black line at the bottom is the 10 states that have given the fewest. The dotted blue line is the average. Maryland is, somewhere between the average and the bottom group of 10 states for first doses. It looks like actually like declining away from the average, I would say. Just not statistical observation, just based on what I see on the slide. Next slide. Same thing for second doses. You can see nationally that they are really starting to ramp up, but Maryland continues to be between, average and the 10 states that have vaccinated the fewest people with second doses. We are the red line on this chart. Next slide, please. We introduced this last week. It just shows for different demographics what percentage of Maryland's population they are and what percentage of the vaccines that have been given out have gone to that population. You can see 60-year-olds, 70-year-olds, and 80-year-olds and older, make up a small part of Maryland's population. That's that blue bar. But a large number of the vaccines that we've given out, that's purposeful. That's because we've intentionally targeted seniors in Maryland. I will point out that, like last week, African Americans make up slightly over 30% of Maryland's population, and to date are around 15% of the vaccines that have been administered. Next slide, please. This shows a little bit more about the percent of vaccinations by race. And the reason I point it out is because it's been acknowledged before that there's a gap. And what I've noticed is that gap has grown rather than closed. And we'll continue to monitor that going forward. Next slide, please. We did this last week. It is the counties. The blue bar is the percentage of the population of the state that county represents, and green is the percentage of the vaccines we've given out that have gone to that county. I'll once again point out Prince George's County, which is somewhere around 15% of Marylanders and is somewhere around 7% of the folks who have gotten a vaccine so far. Next slide. Okay, this is the last one and a little bit different, but this is the rate of first doses. So you can see a place like Kent County, north of 20% of the population of Kent County has received a first dose. And the yellow bar is the percentage of people in Kent County that have gotten COVID, which is around 6%. So I just put this in there in case it shows us something interesting at some point. I'm not quite sure what it says right now, but we will continue to monitor that. That's all I have. Thank you for your time. I'm available for any questions.
Thank you, Mr. Powell. And let's go ahead and hand it over right away to the Acting Secretary Schroeder. And Secretary Schroeder, do you have control of the presentation, or have we?
I think you have control, Mr. President, but.
Jake, can you
do, Mr. President.
Okay. All right.
There you go. If we can go to the first slide, we'll dive right in, Mr. President, to keep this going. This has been a very exciting week. We've got a lot of optimism about going forward. A lot of things are brought online, and we have a lot of new capability in the pipeline. First, looking at the data, we've now administered over 1.1 million shots, first and second doses, and 98.3% of the first doses received have been administered. So we're moving those first doses very rapidly, and the state is now averaging 27,000 plus shots per day, and that's a 105% increase since we first started meeting. If I can go to the next slide. So I wanted to walk through the steps we've taken to expand access. When we first moved into phase 1B back in mid-January, we launched an online portal to serve as a one-stop shop for finding providers. We now have about 222 providers, and that number is going to continue to grow. And this is the approach that's very similar to most states, all but a handful of states do it this way. And as vaccines become more readily available, the infrastructure and logistics network that we've built will greatly enhance our ability to get faster and more quantity of shots to Marylanders. And as the governor and I have said for a number of weeks now, unfortunately, we are currently constrained by vaccines. This is as frustrating for me as it is for you and your constituents, and we are pushing to get more vaccine every day. However, we are planning for a day, and it's not too far off when the situation changes, and your constituents will have many choices about where to get vaccinated. If I can go to the next slide. We had a major rollout last week, which we're very excited about. COVID-19 Vaccination Support Center with a number, 855-MD-GO-VAX. It's open 7 a.m. to 10 p.m., 7 days a week. We're very pleased with this. It's very robust and customer-friendly platform for Marylanders to get assistance. It does things like information on vaccine efforts, scheduling of appointments at our state-run mass vac sites. It identifies vaccine providers for callers and those that are closest to them geographically. It also has English and Spanish toll-free numbers. So if we can go to the next slide. This is what I just mentioned to you. The only other thing I'll say is we can have staffing for more than 500 advocates a week. And then the next slide. Last week, nearly 6,000 inbound and outbound calls were given to segmented parts of the population. And residents can elect to be served by live agents through text messaging or by engaging online via chatbot. So if somebody calls that's tech savvy, they can go to that route. But if somebody really wants to talk to somebody, they can go. They can use our route. Just a little bit of data here. We've booked more than 2,000 appointments, and 619 outbound calls yielded a connection rate of 37%. And before that, when we were testing it, I think I mentioned it briefly last week. We made outbound calls to more than 5,000 Prince George's County residents. Next slide, please. This gives you a little idea about what we've been doing. Some stats: nearly 30,000 calls were received on Friday, and the average wait time was about 7 minutes. We've scheduled about 800 mass vax appointments and have scheduled to date 10,000 plus appointments. And we'll continue putting out the inventory on a rolling basis as we move forward. Next slide. The next thing in March, we're going to be launching a statewide pre-registration system to support our state-run mass vaccination sites. And this is going to allow us to manage the flow of appointments, which we're very excited about. It'll also help us to coordinate with county health departments and allow both the mass vac sites and the local health departments to manage appointments. But most importantly, we expect that establishing a pre-registration system will improve the user experience and better prepare for the day when supplies are very, very abundant. Next slide. So Prep Mod, there's been a lot of questions about Prep Mod. We're finalizing upgrades to the legacy Prep Mod system. These upgrades will address the sharing of vaccine invitations to unauthorized parties, so we can end the sharing of links. And the department is coordinating daily with county officials to ensure users understand and can operate these new enhancements. So the actions I've outlined have one goal, ensuring that all eligible Marylanders have access to get vaccinated. And with me today, I have, again, Chief Technology Officer Steve Colby and our Director of Constituent Services, Tara Hargaden. I also mentioned that by next week, I will be pleased to announce that we have Brigadier General Janine Burkhead will be at the table with me, and she will present her plans to enhance our equity efforts. She and I have been very focused on this topic, and we'll be excited to talk more about our plans next week on that. That'll be the end of the slide presentation, and we're available to answer your questions. Thank you.
Thank you very much, Mr. Secretary. And I do want to commend the department on getting the phone line out. I think that this will be extremely helpful for many who do not have access to technology. And is it staff 24? Are there set hours? Is there is the expectation that a live person will pick up on the line?
Yes, Mr. President, I'm going to turn it over to Tara. She operates and oversees it. Tara Hargan. Tara?
Hi, Tara.
Hello, Mr. President and Senators. Good afternoon. How are you? The operating hours of the support center is Monday through Sunday from 7 a.m. to 10 p.m. And that also operates through our web chat as well as our text functioning as well.
And so if somebody calls during that time period, they should expect that somebody would come on the line. If there are vaccinations available at the mass sites, they would be scheduled. If they're not available, they would be told you can go to another location or you can check somewhere else to look. This is for the mass vaccination sites.
Yes, sir. So scheduling appointments is currently for the mass vaccination sites through the support center. However, the support advocates also are able to assist our constituents in locating a provider that is closest to them geographically.
Great. Thank you very much. Thank you.
Absolutely.
Mr. Secretary, I just have two issues, and I do want to thank you for the information that was sent for the follow-up, and have mentioned that we'll ask members to sort of funnel questions through Mr. Powell moving forward so that we have one collated area of follow-up questions. But the one number that jumped out at me today in the follow-up was the breakout of the cohorts. I understand that for employment cohorts, that's a very difficult thing to try and collate based on that information. But the number of over 70-year-olds that have been vaccinated seemed exceedingly low. It was at 35.3% of Marylanders over the age of 70. And I'm just curious whether you have any national data around that, or is that, it jumped out to me that are, even though they're the highest number, they were at 35%.
Yeah, so yes, thanks, Mr. President. I think the way to think about this, in the first month to 6 weeks of the vaccine rollout, we were very focused on healthcare providers and first responders. That's about 400 to 500,000. And if you look, the data tracks along those lines. We've only been operating in 1B since mid-January. So you figure this is now mid-February. We had about 4 weeks worth of, and if you look at our vaccinations, we get about 80, 90,000 a week. The 226 makes a lot of sense. That means the vast majority of the vaccinations for the last 4 weeks since we opened 1B are going to 65 and older.
Okay. The other kind of major issue is this Prince George's County question. And I appreciate the documents, the county breakdown of who had received. Mr. Powell's going to follow up with the historical information by provider, because really, I think there are a lot of questions about which providers are having the best access to get to targeted populations. In Prince George's, what was interesting, it was the only county that it looked like that there wasn't necessarily a huge racial gap in the county. Now it is a predominantly African-American county, so I guess it should be higher, but it was 3.2% of vaccinated Prince Georgians were Black African-American, 3.28% were white, but overall, it just looked like Prince Georgians were not getting vaccinated. So the gap is lower, the racial gap is lower than in any other county, but overall, it just was surprisingly low on the total number. So we know vaccines are going there, but the numbers are so incredibly low in the total number of residents.
Right. No, I think, Mr. President, you're correct, and we are looking at every possible intervention into Prince George's County that's possible. We just had a sound truck in there trying to target the Hispanic population. We had Temple Reed last week, so we're targeting churches. We're putting multiple channels of distribution into Prince George's County. We have the same concerns. We're not going to rest until we crack this nut, and so.
But is it your sense that out of county residents are largely accessing vaccines in Prince George's County?
Well, we know that at the mass vac sites, we had that the number one and two users of the mass vac site at Six Flags are Montgomery County and Howard County. So we know that. However, as I said last week, we're going to continue to press to get the population in Prince George's County to get vaccinated. And next week we'll have Brigadier General Burkhead. She's been working very hard on this issue, and as I said, we're not going to rest until we get those numbers up.
Okay, that's one we're definitely very focused in on, just to make sure that there's a catch up. The last point is just a general question. That it looks like first doses have gone down. There have been supply issues in the supply chain. Do you have concerns about this upcoming week and a decrease in the number of vaccines overall? Do you expect that for the week ahead because of supply issues?
Well, the supply issue, interestingly enough, and I think the numbers show it, we consumed a lot of the inventory. We're expecting the deliveries, both the backlog deliveries and this week's deliveries, to arrive Monday, Tuesday, Wednesday, and then we're expecting the numbers to start going back up. But we've been in constant contact with CDC. They've been helpful in terms of keeping us informed, and we're managing that supply chain very closely. But you can see the numbers show that we're at 98.3%, but we are expecting to see the next rounds coming as early as tomorrow and then Wednesday.
Great, thank you. Senator Roosevelt?
Thank you very much, Mr. President. Following up on the Prince George's question, when do you think will we actually get the actual data for Six Flags about, of all the vaccines administered at Six Flags, how many are from each of the counties? I know you say Montgomery and Howard are the biggest, but are we going to get a breakdown of how many from Prince George's, for example?
We can get that. I know last week we were working on the overall all of county data, but we'll make a note of that and get that to you. I thought that was on our radar.
Yeah, I would really, I appreciate that. If we could get that sooner rather than later, I'd appreciate that. Second question is, week after week, the numbers that we see that Powell presents shows Maryland in the bottom of the pack in terms of administering vaccines. The bottom of the pack. We think of Maryland as like the best, the first, and for some reason we're not the last, but we're always in the trailer on administering these vaccines. The ones we get, the rate at which we do it, the percentage of population. Why is that? Why is Maryland so far behind other states?
Well, I'll be honest with you. We are finding that there's a data lag at CDC. And I've been focusing my attention on getting the vaccines out. We're actually 19th in first dose administration in terms of getting them out, and the numbers show at 98%. So I've asked people to look into it, but to be honest with you, I'm reluctant to distract people focusing on data and analysis and competition with other states, and really focused on getting the shots to Marylanders. And the data suggests it's 98% of our first doses have been given.
Right, but that's
and
because we didn't.
68%.
But that's because we didn't get a lot of doses delivered last week because of the weather.
Well, but as we open up the capacity, we're gonna get those shots in arms very quickly.
No, and terrific. No, and we appreciate that. I guess I would just suggest you focus a little bit more, not for the ego of the health department, but for the health of Maryland citizens. Clearly, there are other states that are doing this better than we are. We need to learn from them because this is week after week after week, Maryland is way behind other states, and we're all Americans, and we're all dealing with the same supply chains in the United States. We're all dealing with the same rules from the federal government. So it seems to me there's some Maryland specific problem that if I were in your position, I'd want to understand and appreciate it if you look into that and get back to us with why Maryland seems to be so far behind the rest of the country. I have one last question. Do I have time, Mr. President? The Johnson & Johnson vaccine is expected to be approved imminently, and a whole bunch are, in a warehouse in Baltimore, evidently. What is the plan for the allocation of the Johnson & Johnson vaccines once they're available? Because clearly there'll be a lot of demand for them, both by providers and by residents because of the one-shot nature of them. What's the plan for the Johnson & Johnson vaccines?
Well, we're analyzing different options. I'd be interested in your thoughts about what you think we ought to do.
I
I
appreciate.
have some ideas, but I'd just like to hear yours.
Okay, well, I'm sure the president's not going to say that we don't have time for me to share my ideas right now, but I'm happy to discuss that offline. I appreciate you asking.
Let's get together offline. Absolutely.
Sounds good. Thank you.
I am confident that Senator Rosebeth will be very interested in passing along the, with all, truly, respectfully. Next up, we do thank you for recognizing the time, Senator Rosebeth. Senator Eckert.
I'm sorry, I wasn't expecting that. Thank you very much. I'm interested in too, when we get that second round of vaccines, how are we going to deploy it?
Yeah, I mean,
Saying
there's a number of issues that we're studying, and again, I'd be interested in your thoughts. There's issues of the efficacy. Should we be looking at certain deployment of it for maybe high volume? Should we be continuing to focus Pfizer and Moderna on hard-to-reach populations? We're analyzing those, but again, if you have some thoughts, we definitely. I mean, we have ideas. I'm not going to sort of brainstorm on a call like this, but we are analyzing it, and there's different options based on. I'll tell you the one thing I'll be very interested in is the messaging coming out of CDC. Quite frankly, on their take on what they come up, because we haven't heard, they haven't really weighed in yet, and as I said, we've got some ideas, but I'd love to hear from CDC what their thoughts are.
Thank you. And I'd just add that our folks, our friends who are in their upper 80s and 90s are frantically, they've been waiting in line for 6 weeks, still trying to get the vaccine, and our compromised folks, I mean, what I consider medically compromised, overweight, diabetes, hypertension, any of those, I still have a whole group of people waiting in line. I keep telling them it's coming and to call the health department, but it's no opportunity yet. So same thing. Thank you.
You're right, Senator. Right now, we've reached about 30% of the population over 65, and we just don't have enough vaccine. But
Right.
To their credit, the federal government's working hard at it, and we're getting it out there as fast as it comes.
Right. And I tell them, stay home, wear your mask, do all the precautions. It'll be here soon, like spring.
Yeah.
Thank you.
Thank you, Senator.
Thank you, Senator. Senator Young.
Thank you, Mr. President. I'm going to start off with a pitch and then ask a question. We had a delegation meeting this morning, and my school board superintendent both said, put a vaccination shot in Frederick. We're 35 minutes from a quarter of the state's population, so it's a good location for that. But question, how did the locations you're shipping the vaccines to? Do you ever have any local involvement? How do you decide where you send the vaccines to?
Well, the local health departments get about 35% of the vaccine, and based on the conversations we've had with them, have now given them 4-week projections so they can plan ahead. And then, of course, we're looking at sites around the state for mass vaccination sites.
Well, but how do you decide, for example, in Frederick or in any other county, who you vaccines to? Local input on that.
Do you mean on the mass vaccination site, Senator, or just in general?
In general.
Yeah.
And the mass sites too, but.
Yeah. So with the mass vaccination, the first one we put in Prince George's County, and that was the previous conversation. We're very focused on, Prince George's County and creating every access channel possible to get their numbers up. And then, of course, M&T Bank Stadium will handle the rest of Central Maryland. We're going to be in Southern Maryland, Eastern Shore, Western Maryland.
Where?
And then those are to be determined. We're still evaluating the sites. So those are not, as you said, you'd like, yeah, go ahead.
My question still was, how do you decide locally in each county where you're going to get vaccines? Do you get any county input?
Well, like I said, we start with the local health departments who are getting about 1/3 of all the vaccine. And then we pivot to the hospitals. And the hospitals are getting so for example, in Frederick County, the hospitals are getting 20%, and the local health department's getting 67%. So that's about 87% of the vaccine goes to the local health department and the hospitals. And then a small sliver for the transfer pharmacies and the federally qualified health centers. And then we look at the doses per 1,000 across all the counties to make sure we got a tight distribution, and that average has been tightening up. We're being very careful, make sure every county is receiving equitable population-based distribution.
Last week, I asked you, you said there were 18 CVS sites, and I asked where they were, and thank you, you sent them to me. And I looked at them, and all look like they're on highway locations. The one in Frederick, isn't it a location that's very accessible unless you got a car? How did you pick that site?
We actually didn't pick those sites. Those were picked by the federal government, working with CVS and Walgreens.
Okay, I guess.
And the federal government will be expanding that program going forward. We won't have a lot to say about where they put those pharmacies, unfortunately.
So I had always understood they shipped it to the states and the states made the decision. So you're telling me that's not the case?
Not for the good point. Yeah, for the most part, but for the retail pharmacy program, which they're going to expand dramatically once there's more vaccine, they're actually making those decisions, working with their contracts with CVS and Walgreens, among others. That varies from state to state.
Do you handle the testing site and the vaccination site that we are using?
We have, John Weinstein is you talking about in Frederick County?
No, for Indianapolis, for the delegates and senators.
Oh, yes, absolutely, yes.
Okay. Can I just offer you a suggestion?
Sure, absolutely.
Okay, you canceled the ones today. So to make a new one, they don't keep any of the records. I got to go through the whole process all over again. Can't they keep the
and we can follow up on that.
Yeah.
We can follow up on that. This is a conversation we've been having, and appreciate the department's assistance with all of this. This is I think, not unnecessarily in the department's control on the record side.
Oh, okay. I'm just afraid that happens a lot of places. I don't know, maybe not.
All right, Senator Young, we're gonna move along. If you were through with
I'm
questions.
through, yeah.
Thank you, Senator. Senator Washington.
Thank you. And thank you, Acting Secretary, again, for joining us. Just over our last few weeks, so I have a few questions and they build on each other. We've talked about vaccine equity, phone versus website appointments, the mass vac sites, talking about speed and versus equity. So positivity rates, testing rates, our ratios of first and second. So I'm going to return to a couple questions on those areas, but I'm going to ask a question around the last slide that Mr. Powell provided us, where it's showing a gap that the racial gap is growing. Why I mention that in preference is that it seems like the more options you're providing. So in other words, it seems as though your approach is, okay, we're going to provide more options, more sites, that because of the inability to address the structural issues associated with the disparity, you are just going to increase the disparity. In other words, individuals who are able to get access, the more access points you create, no matter where they are in the state, if you do nothing else, it's going to be worse. The disparity is worse. And you see that evidence right in front of your face, that you see that the proportions of the populations going up in the counties, in the areas where there's higher education levels, higher access levels. People are setting up Facebook groups, people are setting up links to get access, and that disparity is growing. So I want to ask very specifically what things that you are doing to address the who, the where, and how when it comes to accessibility to these sites, to getting the vaccines in the right arms.
Thank you, Madam Senator. I'm anxious to get the slides from Mr. Powell. I hadn't seen those before, and I'd like to look at those because our data has shown that the African American distribution has held steady at about 15% for the last 8 weeks. So I would like to look at.
That's not a good thing.
That's not a good number. I'm not suggesting it's a good number, but I want to look at what his numbers are saying, because our numbers suggest that there's been a steady percentage across the last several weeks. Our goal is to increase that. We're working with, of course, the Equity Task Force. They are developing the linkages into the community, and next week we're going to be having a number of community events that the Equity Task Force is going to sponsor. We've been focused in Baltimore, for example, with UMS and Hopkins. They've been going into the zip codes that are most hit and applying appointments to those zip codes. So we are building the process to reach these hard-to-reach populations.
Right. Well, I'm getting frantic. So there's the racial disparities, but again, as both Senator Eckerd and Senator Young have constantly said, that there's still a disparity among seniors who are waiting their turn, but they don't have a friend to make a phone call. They're not they're not on a Facebook group. They're not able to do the links. And I have an email just today, a frantic email from a woman who lives in a condo. She just says that what in the world is going on? If we're such a high priority, why aren't you getting the vaccines to us? There are 5 cases in the last 3 weeks in my condo. What's being done to get to those of us who live in the Petri dish, vaccinated before COVID spreads throughout the building? Okay, so again, this is a woman, I just want to say her first name, Betsy. Again, this again is a woman who, again, the educated, their access, her issue, she lives in a condo And so kind of, it seems as though the approach is about PSAs. The approach, you keep saying there's vaccine hesitancy, and that's sort of a blaming the victim approach. Whereas the data says we need more walk-up clinics. We need more 24-hour walk-up. We need mobile units, right? We actually, maybe we need to reserve some doses for individuals who are slower to get in line. So this is what the national data is now telling us. And so when you look at West Virginia and you look at other places, this is what they're doing. So can you assure us that this time next week that you're going to really look at the barriers that we know, barriers in communication? People are just getting so many different messages or not a message. Give us some assurance here that we're going to address structural issues, not PSA announcements, not parties. That's not what people need.
Right. Well, thank you, Madam Senator. So let me start with a number of approaches. A week ago, when we gave the local health departments 35% of the doses with a guarantee projection for week over week, we also asked them and we gave them targeted independent living facilities in every jurisdiction in the state. And I've asked them to call them and go into these facilities. So number one, we expect the health departments to hopefully do that. Second, we're working with hospitals to do targeted outreach. We have one hospital that's vaccinating as we speak about 7,000 seniors, and they're gonna, along the same lines, and we're looking for other partners to do something similar. And then, as we mentioned last week with the MD GoVax, our support center, anybody can call that support center line and get help. So I think that I've got great optimism that support center is going to do a great job and help along the lines of what you just said. And lastly, I'll say that since we opened 1B and then 1C, which was the 18th and the 25th of January, which was not that long ago, we've had about 4 weeks worth of vaccine that we are pushing out. There's about 900,000 people in the state, 942 somewhere in that zone, who are 65 or older, and we have now gotten to 30% of it. So 1/3 of 900,000 is about 300,000. So we are systematically marching forward, vaccinating that senior population. But you're 100% correct. We're not getting enough vaccine from the federal government, and that's unfortunately the factor that's keeping us from getting more done quicker.
Okay, and then my last question has to do with, and I'll send you actually a list. I have a list because again, there's communication issues. Seniors aren't getting the message. They're not, I'm sure you're reaching out, but they're not getting it. So we need to fix that. But when you're looking at these mass vaccination sites, how do we support people getting them? And I guess that's to an earlier question around if they don't have personal transportation to get to these mass sites. There's also been reports of people standing and waiting in line, seniors in Baltimore City and other sites. They're waiting in line hours and there's nowhere for them to sit. There are no bathrooms. Are you standing at, what are we doing to make sure that individuals who are vulnerable are able to, if they get to the line, that they can stay in the line?
We'll have to follow up with you offline, Senator, to get the details. I know we had one situation last week at the convention center, but that was immediately taken care of and people were brought inside. And I know that some of our providers are providing Lyft as an option. So if you have some specifics, we'll follow up on it immediately.
The only specific, Acting Secretary, is that the state of Maryland provide porta potties, the state of Maryland provide transportation. I mean, again, these are, each week we continue to sort of kick the can down the road or point it in other directions. And I just would really love to see Maryland step up and us not just coordinate and report out, but do the work that needs to be done. Thank you, Mr. President.
Thank you, Senator Lamb.
Thank you, Mr. President. Mr. Acting Secretary, thanks for sending us the county information for those 4 counties that you've broken down. I don't think we've received the rest of the counties. If you could send the rest of the remaining counties along too, that would be helpful. The 4 counties that you provided were helpful, and I just want to start with Prince George's County because of the mass vaccination site there. The data that you provided last week was a combination of week 9 and 10, and it showed that in Prince George's County, where the Six Flags mass vaccination site was located, that at least in those 2 weeks, there were 1,000 doses that were provided out of the Six Flags site. Now, from what you've also said earlier, that about a quarter of those going to Six Flags are coming from Montgomery County, almost as many are coming from Howard County. That means that about half of the individuals that are going through Six Flags are actually not from Prince George's County. And so I'm trying to understand how that's supporting the inequity that's occurring in Prince George's County when we look at some of these numbers and see that Prince George's County has some of the lowest vaccination rates in the state. And I understand the need to put a mass vaccination site there. But when you're counting those mass vaccination shots against Prince George's County's allocation, and a whole chunk of them are not actually going to Prince George's County residents, I think that's inequitable in some ways. And so what are you doing to address that? Because the more mass vaccination sites that you open up, the more that you're actually taking top of all of the doses that the state is receiving, and fewer doses are actually reaching the local health departments where it's much more targeted in where those doses are going.
So Senator, let me just clarify. I'm looking at the chart from Prince George's last week where we had a 2-week total of 18,700 doses. That does not include the mass vac sites. So these were just to Prince George's County, hospitals, federally qualified health centers, 39% to the local health department, 21% to the hospitals. The doses that are coming out of the mass vac site are over and above that.
So, but the mass vac sites are coming off of the entire state's allocation, right? So the more mass vaccination sites that you open, particularly in a time when the vaccine supply is scarce, the more you're just subdividing the pie. You're slicing the pieces of the pie even narrower going to the local health departments because the pie is not getting any bigger at this point. What you're doing is slicing the slices even smaller.
Yeah, it actually is getting incrementally bigger, by 5% week over week. We're hoping that'll continue. But what we're anticipating is a rapid expansion, sort of like a chemical reaction. We're going to get a rapid expansion of the vaccine when we get J&J and when the manufacturers open up. And we want to be ready to move those vaccinations out very quickly. We don't want to wait to build the infrastructure and then have the doses sitting around. So,
and I agree that
we're doing this parallel.
And I agree when the supply is more abundant, I think having more mass vaccination sites is appropriate. But when the supply is very scarce, the more that you open up these mass vaccination sites and splinter the number of increase the distribution points, the smaller the slice of the pie get. And I'm concerned that particularly local health departments and hospitals who've been clamoring for more doses are not receiving any increase in doses. In fact, they're probably at half the number of doses that they received just a couple weeks ago. I think that's where it's important to actually understand the formula that you're using to allocate these doses, but I haven't seen a formula being provided to us or being broken down in a way. And I think that's if you can please provide that information, that would be helpful for us to understand. I think to Senator Young's question earlier, how are these doses actually being allocated, whether it's to local health departments, hospitals, retail locations? I presume that there is a formula that you're using or some kind of a rationale that you're using to distribute this, but we've not seen that yet.
Yeah, the baseline is the doses per 1,000 per county, and I think we've shown that once before. We can bring that again. That's the baseline calculation, and we can provide that again.
And then with regards to these second doses that I know were an issue a couple weeks ago, it's my understanding, and even from your bulletin last week, that not everyone has received their second doses yet. I think there's still some folks that are just either this week or later this week, hopefully getting their second doses that went missing a couple weeks ago. Is that correct?
They would have gotten them last week. Unfortunately, the snowstorm interrupted the supply chain. From last weekend throughout the week, the snow, and the unfortunate problem is the snowstorm started in the south, which was at the front end of the supply chain. So it shut down the supply chain in the south, and then it started moving north, which also disrupted it. So we've had about 10 days of supply chain disruption that is now clearing out. But the second dose issue was resolved, and everybody's going to be getting their second doses now that the supply chain's been restored.
So everyone should be made whole by the end of this week for folks that are missing second dose supplies, right?
That's my expectation.
And then my last question then has to do with the accounting of these second doses. I'm hearing that Ernst & Young has entered into a contract with the state, or the state has entered into a contract with Ernst & Young to the tune of about $11 million to be able to track these doses and to also send notifications out. Can you confirm that a contract went out to Ernst & Young to handle the accounting of these doses, what they're doing and what the correct cost is?
Well, Ernst & Young is doing a number of things for us. One of them is to help us with getting very, very close operationally to the supply chain. They have national perspective. This gets back to Senator Rosapep's point. We brought them in because they're working in a number of states and they have perspective on how this supply chain should work. They've already helped us on a number of things, not just this accounting, but they've helped us to unravel some of the mysteries of the federal allocation and accounting system.
How long have they been working with you? Because I'm not seeing in the Board of Public Works agenda.
It's an emergency contract that should come through the normal channels of the Board of Public Works.
And how much is it for? How much is the contract?
Yeah, I don't have the numbers in front of me. I don't want to speculate, but we can follow up. And if you'd like next week, we can give a brief. But they're doing a fantastic job, and we're very fortunate. And as you know, they are giving us a window on the national scene so that we are better prepared. So.
I mean, I think if you could follow up with that information, that'd be helpful. This is a fairly substantial contract. If it's correct, that's $11 million. I presume you probably signed off on it or are aware of the details. It seems like you're not ready to disclose them now, but I would like to know what they're actually doing, because if they've been working with us for the last couple of weeks, it doesn't look like our rankings have changed that much in terms of vaccine administration when you compare this to other states. So I would like to know if we're actually paying that substantial amount to them and what we're getting out of it.
And we'll add that.
Talk about that.
We'll add that as a follow-up. Senator Roosevelt did have another question, if you can make it very brief.
Thank you very much. Expected number of doses we're going to get each week over the next couple of weeks in Maryland?
We're expecting a little about 118,000, but that's a very large jump because the Pfizer went from $9.75 a box to $11.70.
I get it. I understand how they're expanding it, but I just want to get the numbers. You're expecting for the coming week. You're expecting how many?
Our numbers right now are 118,000. Moderna and Pfizer.
And for the week after that?
We're only getting a week or two advance notice.
Okay.
We're giving, yeah.
I got it.
We get 2 weeks. 2 weeks.
That's right. So it's 118 for each of the next 2 weeks. Got it.
That's correct.
Second question is, when are you expecting to get the big boost in the two dose vaccines that the president talked about on Friday and the Johnson & Johnson ones? In your planning process, I know you don't control it, but in planning, when are you expecting to have the big boost in number of doses?
We are working now on projections, but again, projections. But
I know I'm asking for projections.
Yeah, I don't have it in front of me, but we can talk more about our projections in the next couple of weeks. But we are making projections about what we think. Again, they're guesses, but if, we're hoping to find information from the federal government on very soon on what they plan to do. The one thing I'd be interested in knowing, if any of you all have connections somewhere that would help us, we've been trying to figure out, does the federal government plan to give the Johnson & Johnson to the pharmacy program, or do they plan to also give doses direct to the state? And
Great
we're
question.
not sure. We're not sure about that.
Happy to follow up with you on that. If you could
That
get
would be great.
for next week, though, with your planning horizons on a big boom, because I mean, planning for that, it could all collapse. We have the problem of scarcity now. We could have the problems of abundance 3 weeks from now. So it'd be what the planning is.
Well, Senator, you're right on the money, and that's what I've been saying.
Yep.
It could happen. I mean, it's anyone's guess. I don't want to speculate, but you see the horizon, and when it happens, we got to be ready. You're 100% correct.
Let's hope for
Amen.
that problem sooner than later. And we
Exactly.
have to close up. Senators, please, we are going to have Mr. Powell coordinate the follow-up questions so that they're all being directed for one spot, so that the department has a clarity as to the follow-up from each week. So please be in touch with Mr. Powell so that we can get those questions over in a timely way, so that the department has time to review them and get them back before next week's meeting. I want to thank the acting secretary for your presence this week. We are moving along, and hopefully those doses catch up this week for the backlog and supply issues. And we look forward to seeing you next Monday.
Thank you very much, Senator, and Mr. President and other senators. It's been a pleasure. Thank you very much.
Thank you. Stay safe.
Yep, you too.